My name's Louise Bamford. I'm here to do Elizabeth Finney's paediatric life support assessment. It's part of component 16 of the apprenticeship programme. Beth, can you just introduce yourself with your PIN number and cohort, please?
Yeah, my name is Elizabeth Finney, PIN number 50556 and cohort 2504.
2405, that's the one. Easy mistake to make. So I'll give you your story. Are you all right to carry on with this assessment?
Yep, that's no problem.
Okay. So I'll tell you what you're going to. I'll be mum, and then I'll come in as paramedic afterwards.
Yep, that's no problem.
So you are attending a 5-year-old child who was eating his tea and he suddenly started coughing. He's coughing and mum's trying to clear his airway. It's come through as a choking.
Okay, no problem. So I'm going to gather my equipment, don my PPE. There's no special precautions in place at the moment, so I'm going to make sure that my hands are washed and clean, and I'm going to take some gloves as a precaution. Upon approaching scene, I'm going to be doing my DORA, making sure there's nothing that I can slip, trip or fall onto, and making sure that there's no safety hazards, no gases that I can smell. I'm going to walk into the property and I'm going to note the patient. I can see that a guardian is doing back slaps, and I'm double checking on the floor for any catastrophic hemorrhage as well. Now I'm going to approach the patient. Hello, it's the ambulance service. What's happening?
I can't get him to do anything.
Okay.
I've asked him to cough and he won't.
Right, okay, so I'm going to call for paramedic backup. It seems like the child is choking. I'm also going to encourage the child to cough.
Oh, can I give it to you?
Yeah, of course you can. Can you cough for me?
He won't. He's not paying any attention.
Right, okay. So now what I'm going to do, because of the patient's size, I'm able to get them on my lap. And I'm going to support the airway there. I'm going to do 5 back slaps. 1, 2, 3, 4, 5. Checking if there's anything come out.
Nothing come out.
Okay. Now I'm going to, because of the patient's size again, I'm going to be doing chest thrusts on this child. We could also do abdominal thrusts if the child was a bit bigger. 1, 2, 3, 4, 5.
Nothing came out.
Nothing coming out. We're going to revert back to back slaps. Again, holding the airway clear.
And as you start doing that, you feel your child's getting a little bit floppy on your legs.
Okay, I'm going to call for some paramedic backup again. Patient is now unconscious. We're going to assess breathing. This is a possible child cardiac arrest.
They're about 5 minutes behind you.
Okay, we're going to expose the chest. We are going to do a cross finger technique. Look in the airway.
Nothing found.
Nothing found. If there was anything in the airway, I'd use my gills, or I could use suction. I'm going to maintain a neutral position for the airway because this is a paediatric. If this was a baby, I'd tilt the head slightly or put something under the neck to maintain that airway, and only use the bone. So I'm going to look, listen and feel for 10 seconds, checking the pulse.
You can't feel anything and you can't see rise and fall on the chest.
Okay. We're going to get our oxygen. And we're going to do 15 litres for this patient, and know that this is a critical illness, so I don't have to check JR calc. I'm going to measure my BVM mask from the chin over the nose, making sure that fits properly. Release the pressure on the oxygen, turn to 15 litres. Wonderful. And we're going to start by doing 5 rescue breaths for a paediatric. Making sure that there is that rise in the chest. Now I can see only 1/2 of the chest is rising, which may be signs of a tension pneumothorax, or it might be signs that the obstruction from the mouth has now gone into the lung. I'm now going to do 15 to 2. So and 2 rescue breaths, making sure that those compressions are going a 3rd depth.
My name's Louise. When you finish this round, I'll take over here and you can sort the defib out.
Yeah, no problem. I'll just do these 2 rescue breaths for you.
Thank
Thank
you.
you very
I'll
much.
take a hand over afterwards.
Wonderful. I'm going to set the defib up now. And get the defib pads out as well. Now, because of patient size, what we're going to do is I'm going to put one pad on the front, one pad on the back. In between compressions, we're going to do a ready, steady roll once the defib is ready. I'll attach the front whilst you're doing the next rescue breaths.
9, 10, 11, 12, 13, 14, 15.
Wonderful. I'm going to ready, steady and roll. That's brilliant. Position that on the back of the ready, steady, roll. That's brilliant. I'm going to set the defib to child.
Immediately resume CPR.
And to 15
Immediately resume CPR. 15 chest compressions, then 2 rescue breaths. Continue until patient is breathing normally.
Scoop from the ambulance, we continue CPR. And then what I'll do is I'll do vital signs on the ambulance. We need to stabilise the patient as well before we get them on the ambulance.
So if we now imagine I've got a team of people, we're all working on this child, you're going to put a standby into the hospital. If you want to take your time to write bits down, you can do.
So we have male aged 5 was eating his tea. Mum found him choking. I've come on scene. We've done 5 back slaps, 5 chest thrusts. As we were going into the second round of back slaps, child's become unconscious. We've then proceeded to do 5 ventilations into 15 to 2 CPR, still a GCS of 3 unconscious. ETA is approximately 5 minutes.
Okie dokie. Can you tell me what rhythm you've got on the screen, please?
So at the moment, we've got either normal sinus rhythm or without a pulse, we've got PEA.
Okie dokie.
We wouldn't be shocking that.
Lovely, thank you very much.
This is a VF, we can shock that in adults.
Lovely.
This is asystole, we don't shock. This is VT. Before we do anything, we check for a pulse. If there is no pulse, then we shock.
Okay, thank you. So before you put the pads on, can you tell me a couple of your 6Ps that you're looking for?
Yep, so we're looking for pacemaker, patches, pendants, pelt, perspiration and any piercings.
Lovely. And can you give me
Do not touch the patient.
Turn that off now. Can you give me your reversible causes, please?
Yeah, so we've got 5 H's. We've got hypoxia, which is the most common cause for child cardiac arrest. For that we give 15 litres of O2. We've got hypovolemia, which is a loss of fluid, can be caused from bleeding, which we stem, or it can be caused by diarrhea and vomiting as well.
Sorry.
There we go. Hypokalemia, that can be tested at hospital. It's potassium. We've got hypothermia, which we do a temperature for en route, and we try and warm the patient up. And then we've got hypoglycemia, which we do a BM for.
Okay.
Then we've got 4 T's, which is tamponade. We'd normally look for any bruising, any raised area on the chest, and senior clinicians can put a chest drain in to help that. We've got
Is that tamponade or is that the other one? So tamponade, the fluid around the heart.
Yeah.
The chest drain would be for what?
Oh, chest drain might be for tension pneumothorax
Lovely,
instead. Yeah, tension pneumothorax is a collapsed lung, which we may have caused then, especially with no rise and fall in the chest. Then it can be caused by abdominal thrust or chest thrust. Thrombolysis is a clot in the lung that needs to be sorted out at hospital through blood tests. And then toxins, we take a medical history from mum. see if child's been around any drugs, anything that they shouldn't have been around that they could have ingested.
Lovely. So, and this isn't for a pass or fail question, I'm just going to push you a little bit here. If you suspected maybe this child's had some diazepam or found his mum's codeine, what kind of drugs might you have that you could maybe assist?
We could give naloxone, or we could contact Toxbase as well, see where we can go from there.
Lovely, thank you very much. So you've managed this child at this age quite well. If you had a maybe a 10-month-old child, what would you do differently with your hand position?
So if it was a 10-month-old child, we'd do either 2 fingers to the chest, or we could hold baby and do 2 thumbs instead.
Lovely, and you did mention that you might try and put something under the head and the shoulders in your assessment. Is there anything I've missed there, Jake? Oh, I have missed something. If when you did your ventilations, you couldn't get any rise and fall, you'd considered the blockage, you considered pneumothorax, what might be wrong further up?
So we consider an OP airway to open that airway up and stabilise that.
Lovely, thank you. I'll let you have a look now.
Yeah, that's okay. We answered all of those questions. I think we've considered everything there.
Lovely, thank you very much, well done.
Thank you.